This is another exercise which is an advancement of the glute bridge exercise. It's very, very good for teaching stability and control in the medial glutes, so the glutes at the side and the adductors. First thing you want to do is assume a normal single leg glute bridge position. Now, if you find this is very goes into your hamstring more than your glute, you need to focus on what's called a posterior tilt and scooping your hips underneath you. So that is where you want to scoop and make room at the lower back and bring your hips closer towards you, so you're shortening the lower part of the abs. You want to make sure that you can feel the glute, and we have this active foot position again where we have the middle of the knee and it goes right through the little toe, so the second toe here. We're going to push our hips up to the side so we have one foot that's off the floor into this glute bridge position. Now, what this does is it teaches how to lengthen the adductors as we move the body to the side, which is absolutely brilliant for stability in different planes that we're used to training in. So what you want to do is slowly take this foot out to the side like so. Now, during different ranges of the movement, your knee's going to want to fall in and cave into this position. What you're doing by driving it out is we're getting a really good contraction in the glute at the side, and again we're lengthening here, so in this adductor, and we're lengthening here in this adductor. So we've got a great stretch through this midline of the body, which usually gets very, very tight in conventional training. You want to take your foot as far down as you can, then return back to this position. Always using the abs at every point, fighting the urge for the knee to come in, and then steadily bringing it back up with control. You get a really good stretch in this one. It teaches you how to use your midsection in conjunction with the glutes, again in this different plane. So to look from the side, what we want to do is we want to lie down on our back. We're pushing our hips up. We're making sure we've got the glutes engaged already, so the glute max, so the main muscle. We're going to slowly rotate, open up our hips to this position, and then bring it back to the top. We're going to slowly rotate, open up, pause, and then pull. Now what you'll see here is this part here, so this part of the knee, the inside of the knee, connects right the way through the hips and through to this part. So we have a group of muscles that connect all the way from here to the opposite side where our right shoulder is, and there's a sling. This is getting a fantastic stretch while stabilizing the opposing side, and then we contract it and bring it back up. If you find that one side is a lot weaker than the other, then do it with your bestie capabilities, but focus a little bit more on that side and make sure you have an even amount of strength in both sides prior to doing any of your compound lifts. But if you do have ipsilateral hip pain, so pain on one side more than the other, this is an excellent exercise to do and get the opposing side up to the same strength as the other side as a way as managing pain.